Eileen, what's new? What's coming out in the pipeline? You're so involved in the world of research. What do you see that it's coming out, that it's very good, that it's going to provide something new and different that may have better results nowadays that are being offered to our patients?
So there's a lot happening in the field of research for pancreas cancer, and as oncologists, and we're excited about this. So there are a lot of new drugs in development, some very early on in development, some at later stages of development, and many of these new treatment approaches come from an improved understanding of the development of pancreas cancer, of genetic pathways that may be important in this disease. Pancreas cancer is a really complex disease genetically. There are a lot of changes in the cells that happen over time, and we now understand better which of these pathways and genes are important in outcomes in pancreas cancer, and we have new drugs that are targeted specifically at vulnerabilities in those pancreas cancer cells. So I might give you an example here. We know that a certain subset of patients with pancreas cancer will develop the disease based on a genetic change that may run in their family. For example, the BRCA genes, which are more known for their association with breast and ovary cancer, but pancreas cancer is a key disease that's associated with changes in those genes. And not just does this provide a possible screening opportunity for families and individuals that may be carriers of those genes, but if people go on to develop pancreas cancer, we now have an ability to exploit that vulnerability by targeting with certain drugs that interfere with repair of people's DNA in the cells and may make the best treatments that we have more effective in cancers that arise in that setting. So that's a concept that's being actively evaluated. That applies to a subset of patients with this disease, but there's probably about 50 to 100 new compounds in early development where I think we hope that some of these will become tangible treatments for this cancer going forward. I think another area that's really important is that we've attracted a lot of new investigators into the field, physicians that are interested in pancreas cancer, scientists that are interested in pancreas cancer, and that's the way of the future, right? The next generation to be enthused and excited about this disease, to have focused intellectual efforts to develop new treatments, and on a national level to have improved funding and grant supports for development of new treatment opportunities is really key also to improved outcomes.
No, that's very good. Those are very good points, and I'm happy to hear that there's so much going on, and that the patients know and understand that we're fighting with them, and that we're here, in this fight with them, and that hopefully very soon it's going to happen with pancreatic cancer, what we have seen with colon cancer and breast cancer, that initially was a cancer that there was not much to do, and nowadays, again, depending on the staging, it's a disease that we can completely cure with excellent outcomes.
Yes, that's true. For early stage disease we can, but for the majority where we can't, I think the message we want to convey is that there's hope, there's opportunities, and that maybe we can't cure it, but we can control the disease, and we're beginning to think of this concept of a chronic disease that's not totally applicable yet, but that's where we want to go in terms of the future for people who aren't candidates for surgery. That we have opportunity to help the cancer, to control the disease, to improve quality of life, and to extend life. And I think it comes back to this discussion of a real public awareness about this disease, from education, from treatment, from access to multidisciplinary centers of support, from support from advocacy organizations, from the government in terms of funding and research. All of these are critical areas for continuing to improve outcomes for patients and families where this disease is present.
Eileen, thank you so much for your comments and your insights.